In April of this year, the government passed a number of measures that will impact the delivery of supervised consumption services in this province. We are moving from a model of delivery that's based on anonymity and confidentiality to one where anytime anyone accesses safe consumption services in this province, they have to give personal identifying information. And as folks can imagine, that creates a major barrier for folks willing to access supervised consumption sites. It's going to lead folks to no longer receive these services, consume substances in unsafe manners, increasing the risk of overdose and other harms, and perhaps even death. In addition, the new restrictions prevent overdose prevention societies or service providers from operating.
Our children would not have died if they had had access to supervised consumption sites. This support was not available to them, and so they died alone with the shame and stigma our society and out-of-date drug policies put upon them. We advocate out of a sense of hope. However, if people are not kept alive, neither is our hope for a better tomorrow and for lives saved. As members of Mum Stop the Harm, we strongly oppose the new provincial recovery guidelines. These guidelines create barriers that will keep people from life-saving services. By launching this lawsuit, together with Lethbridge Overdose Prevention Society, we hope to help save families from planning funerals that need not happen. We hope to save lives and to give people hope for the future.
It is thanks to these overdose prevention services that I am able to live a happy, functioning life where I have friends, I have my education, and I have family. I have really everything that I could want, even though I do still use intravenous drugs. And when I was reading the new regulations that were released for overdose prevention sites, one thing was abundantly clear to me. People who use drugs were not consulted. With personal health numbers now being required, many people who use drugs do not have personal identification cards, or do not have healthcare numbers, or have no way to prove what their healthcare number is. So this creates a very, very direct block to an estimated 60 to 70% of the people who use the safe site right now. And without having those safe spaces to know that if you overdose, you're going to be taken care of, that is going to lead to a massive increase in overdose deaths.